Well, as I have just said, I have just thanked the organization to invite us to this table. We are going to start with Dr. Lyron Pantanowicz. He is a professor of pathology and biomedical informatics and director of pathology informatics and cytopathology at the University of Pittsburgh Medical Center. He's also the editor-in-chief of the Journal of Pathology Informatics, and today he has presented us a presentation about his experience with Omnix. In Pittsburgh, they have made a joint venture with General Electric, and they have developed a very interesting solution in telepathology. His approach is going to treat about different matters of the return of investments of these kind of projects, and he also is going to tell us about his own experience in the implementation of this solution. So, Dr. Lyron, what do you want?
Hi, everyone. I'm going to be speaking in English, if that's okay. I'm from the US. Thank you, Juan Lucas. It's a privilege to be here. I'd like to thank Dr. Marcel Garcia-Rojo for inviting me here to Spain to talk about one of my favorite topics, which is telepathology. And the title of my talk is Insourcing and Telepathology and the Experience We Have Had in the USA at UPMC, which is the University of Pittsburgh Medical Center. UPMC is, in Pittsburgh is a beautiful city. It's known as the city of bridges. We have the most bridges of any city in the world because we have so many big rivers. So you're welcome to come visit us anytime. As a disclosure, I am a consultant for Omnix, which is a GE and UPMC joint venture. So I have 3 objectives to share with you today. Number 1, I would like to tell you about the different solutions that UPMC has used telepathology. I would like to tell you about some of the lessons we have learned using those telepathology practices. And hopefully I can convince you that investing in digital pathology is not just something that's novel, but we have invested for a return on investment. So we are looking to make money off digital pathology. At the same time, improve quality of care and treat patients. So I want to show you how we've done that. We have 2 choices. Number 1 is we can do it ourselves, is what I call in-house or insourcing. And sometimes that's a difficult road, as you can see. The other option is to outsource, is to maybe work with a vendor to come up with a solution. So I want to present both of those options. By insourcing, I mean that we are bringing cases from outside, such as in China, to be read at UPMC for extra revenue. And the solution often is, our own solution. For telepathology, basically, we are looking at those cases and making a diagnosis. Many times, we are not able to refer back to the glass slide, such as in China. If you make a diagnosis of cases in China, you cannot get the slides because slides, tissues, and blocks are not allowed to leave the border. So it's only a digital option. There's no other solution. So this was the first solution we came up with. We made our own digital pathology consultation portal. We built this 5 years ago, and we developed it ourselves at UPMC, and we maintain it ourselves at UPMC, this digital pathology portal. And we offer 2 types of products. If we have a dedicated client, a client says that they want to work with us exclusively, send us thousands of cases every year, we have a dedicated way of doing that. But we also have a general client. So we have 160 pathologists in my department, lots of specialists, for example, 10 neuropathologists, 4 head and neck pathologists, a lot of pathologists. And someone may have just 1 case, 2 cases a month that they will send us, and so we have an option for that. We've realized it's very important to do telepathology synchronously. In other words, not just one way. You need to be able to go back and forth, talk to the other pathologist to come up with a good solution. And you have to keep updating your solution. So we customize it ourselves. And there is a charge for this. If it's a dedicated client, there's a contractual arrangement. So we'll do 5,000 cases a year. If it's a client who's only going to send 1 case a month, then there's 1 fee the service. And we started 5 years ago, but now we're getting several thousand cases a month coming to our hospital. So that's what we have. We created on the web a portal. People log onto the portal and can send us cases. And as I said, if you are just a general client, you're only going to send one case, then you have to upload the case to UPMC. You enter the information and we'll give you a report. If you're a dedicated client, then our IT team works with your IT team. We access your server. We need to, we don't have to upload all the images. We can use your server, and basically we have an IT connection, and that way we can do 5,000-6,000 cases a year easily. So this is how it works. We try and automate that process. So for example, with a client in China, which is KingMed, a very big reference lab, when they have a case and they scan their cases, it registers in UPMC. We print out on their printers barcodes. The slides get barcoded. We use the barcode to automate the process. We noticed in the beginning, 5 years ago, that we had some connection problems, latency problems. The files were taking long to download, which was frustrating the pathologists. And the reason was in China, for example, they have firewalls for internet connection, which we have no control over. So we came up with an alternate solution, which is when we pinged the server, we wanted to see how quick does it take to download images. You can see on the left, if you're in Pittsburgh, in Pennsylvania, in USA, it's very quick. But if you're trying to get images from a server in China, it takes a long time. Not a long time, I'm saying 7 seconds. 7 seconds for a pathologist to wait at a monitor is a long time because they want to finish their cases and go home at the end of the day. So we were trying to get from 7 seconds to 1 or 2 seconds. We use commercial software that radiology use. This commercial software is called Aspira. What happens with Aspira is the minute a case gets scanned and lands on the server, right away it gets into what's called a hot folder. Hot folder sends it straight to our server in Pittsburgh. There's no zip compression. We've avoided compression. We have no batch processes, no manual process. It's all automated. So now, when a pathologist gets a case, they have a choice. You can see at the bottom, you can pick the images in China or you can pick the images in Pittsburgh, so that there's no delay. So you want 7 seconds or 2 seconds to look at a case, you have a choice. The portal we designed had to meet lots of users. The first one is when a case comes in, you need someone to administer and triage the case. Does it belong to head and neck? Does it belong to gynecology? Then there's transcriptionists, people to generate reports, and pathologists. So we support lots of type of people using these. And the viewer is an agnostic viewer. We can take lots of different scanners, easily look at those cases. We've built in communication, so you can talk all the time to the other pathologist. There's a pathologist in China. I can ask them questions. Can you do this? Can you add that stain? Can you find out if the patient had a previous cancer? And that's very helpful. So we have a true partnership, bidirectional. They send us cases, we give them reports, and we help their patients. So we found that for all the cases they send us, about 2/3 of the time, we are changing the diagnosis significantly. Significantly means the patient will get completely different treatment. So if someone was told they're going to have sarcoma and get an amputation, we'll look at the case, we'll tell them it's just a reactive disease, they do not need surgery. So 2/3 of the time we are making a change for the patients. And therefore we've noticed a change of who is sending us the cases. In the beginning it was pathologist to pathologist. Then it was clinicians saying, can you please send it to the US? And now it's patients are saying, can you please send it to the US? So this has been very successful from a clinical point of view and financial point of view. People are looking in emerging countries to send cases to the US because we have a lot of expertise, specialists. It's improving the patient care, but it will only work if the leadership on both sides agree and continue to support this. You need pathologists who understand both sides culturally and IT connections. IT problems usually are connectivity with firewalls. but if you have dedicated IT resources, you can do that. So I mentioned that UPMC have joined with GE to form a company called Omnix. Now, UPMC as a health institution cannot go to every single country in the world, but Omnix are providing solutions globally around the world in a lot of emerging countries. And basically that allows us to provide our resources, which is expert opinions for clients around the world. It's an easy option. With a web-based solution, you can share cases, and our early experts can provide a diagnosis. So you can see a quick case. You send it with a web link. We give you a second opinion, which again helps the pathologist around the world. So we've found that partnering with the vendor in this example was profitable. It broadened our teleconsultation experience. It helps us because we don't have to provide local support. The company, Omnix GE, provides the local support. And what we found very interesting is pathologists around the world don't just want second opinions. Actually, once you start to build a relationship, they want to partner, they want to share best practices. So in other words, what are we doing in the USA? What new tests, new antibodies, can we share that with them? And also some academic partnership, which has happened. So that platform is working well for us for telepathology. Now, for 10 years, we have been doing frozen sections by telepathology, which means we have scanners around all our hospitals, and we use remote robotic microscopy to do frozen sections. Pathologists do not go on and do frozen sections because the hospitals are too far. And so that's worked very well, especially for neuropathology. And because of our neuropathologist experience for 10 years, other hospitals in other states, even far away, have asked us to provide frozen section coverage for them. And so we have started doing frozen section coverage for other hospitals that are not connected to our system. So simply with connecting to a microscope and software, you can do a remote frozen section, and you can see even 370 miles away, we're able to real-time give a frozen section diagnosis, and that has helped care. The advantage of that is, since we have so many specialized pathologists, we are using those centers of excellence as a resource. We're able to use it for frozen sections. We're able to do real-time frozen section telepathology. And the IT issues are usually not a problem. The real problems are administration and billing. But good communication has worked well. So we realized that not everyone can afford some of this equipment, which is expensive, and therefore we started to look at mobile devices like cell phones. Cell phone you can very easily attach to a microscope, and we built an app on the iPhone called Pocket Pathologist, and that basically attaches to our web portal. So we have started to offer that, and you can see for people who cannot afford a scanner or even a digital camera, they have a cell phone. You can easily attach the cell phone to your microscope. Lots of different options, and you can see it takes very good pictures. You can even capture video if you want. And then you use our app on the phone, you upload the images to UPMC, and we'll give you a second opinion. And we've had a few cases. For example, here's one case, people take photos, upload them, we give them an opinion. The quickest turnaround time we ever had was about 1 or 2 minutes. It happened that the person took a picture, uploaded it, the pathologist was at the computer, gave a diagnosis right away. So they were very happy. We usually give instructions. Once or twice people don't remember to turn the camera forward, backwards, so we've had some selfies uploaded also. So we learned that the cell phone obviously is a very good device for telepathology. They're very portable, connect to the internet, and they're cheap. They have very good cameras. And from that, the quality of the image, we're able to make a diagnosis. The only thing at this point is we are not marketing that service to all countries outside the US. So we've been approached at UPMC to work with some other companies that do telepathology networks. And I'll tell you 2 examples. One is Xiphon and Quality Star. So Xiphon is a company that has a product called ProNet. It's just a software solution that they connect pathologist to pathologist. And we joined them about 2 years ago. You go onto their software and you create your own profile and you tell them what you specialize in. So for example, there's my profile. I tell them I do bone and soft tissue pathology, I do cytopathology, and if anyone needs a case, they can send it to me. It's easy to install because it's a vendor-provided solution, web-based, but after 2 years, we have not received any cases. And that is because pathologists don't market themselves. I don't go to meetings and say, hey, I'll do consults for you. I don't send out memos. I don't do adverts. So it's provided an IT solution, but it hasn't really benefited us because, we don't market that resource. Now, there's been a lot of emphasis for more quality assurance QA to do second reads. In other words, pathology departments should be looking at 10%, 20, 40% of their cases should be checked by someone else. That's a good thing, but the problem is who's going to take the time to take all the cases, send those slides to someone else, and, whoever's going to review the case should be as good as you or even better than you to check your work. The problem is it's hard to convince pathology departments to do that because you don't get paid extra to do extra QA. There's a company called Quality Star that approached us. They have a digital pathology solution. So what they do is they go to small hospitals in the US and they say, we can get your cases reviewed, get them checked, we'll scan them, we'll give them, they'll do it digitally, and people like that because they don't have access to experts. So we agreed, UPMC and our cancer center, to do second reviews for these other smaller labs because we have so many pathologists. We have 160 pathologists. So it works basically if you're a small lab, you have a lab, you're only one pathologist or two pathologists. This company will come, they scan your slides, they give it to a center like UPMC. We do the second reads. They provide some QA and they give it back to the lab and tell them you made mistakes on these cases, those cases, and they improve their quality. But what we found from that is, while it's easy to do that, the problem is this is a high number of cases, high volume. It's not like the consult cases where you can get 1 or 2 a day. This is, 1,000 cases a day. And because they say they're easy cases, they don't pay you as much as a consult. So it's high volume, but it's easy work, but it doesn't pay so well. So we really have to look at that is, do we want our pathologists to be doing this extra capacity work, that may be not so profitable? So it's something we're looking at. So this is the conclusion of what we have been doing for the last 10 years for all these different, telepathology practices. Number one, we realized that with 160 pathologists in our department and people with expertise, that's a very marketable resource because lots of countries, China, etc., would like us to give them second opinions. So investing in digital pathology for us has been a good profit and a return on investment. So the money we've made back has paid for all the equipment and time we invested. And we figured out that, doing these kind of solutions ourselves is better than, using something like ProNet, which we haven't benefited from. The technical things which most people worry about is that it's going to be difficult from an IT perspective. That's been the easiest. The IT part is easy. It's the administration, the billing, and the legal issues that usually is much harder. The expensive, actually, many people say that the equipment costs a lot of money, and in truth, the equipment is actually the cheapest part. It's the IT people to maintain this in the long term that's more expensive, to have the right people employed to do the work. We found that once you establish a relationship, you have to continuously communicate with those people. So continuous communication actually sustains the telepathology practice. And it involves not just the people doing the work, but the leadership on both sides have to agree. You need the correct IT people with the skills to do the work. If you don't pay people and there's no incentive to actually in the long term make money for yourself and your system and better the healthcare, then that's difficult, but you need the capacity. So that concludes my talk.
Okay, thank you very much, Darren.